is a 2-minute warning. Reporters, please press 1 to raise your hand to indicate you have a question.
Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services. Director Mike Sprayberry is in Sparta, North Carolina today discussing earthquake recovery with local partners. But I'm joined by Monica McGee and Brian Tipton doing our American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish translators. I'll start with a rundown of the numbers. As of this morning, there are 157,741 lab-confirmed cases. 1,000 people are currently hospitalized with COVID-19, and sadly, there have been 2,570 deaths. Throughout our response to this pandemic, we've been encouraging all North Carolinians to protect themselves and their communities by following the 3 W's: wear, wait, and wash. These are our first line of defense against the virus. And as a state, we have seen positive signs in our trends thanks to the 3 W's. But we know that this progress is fragile. The 3 W's is going to be part of all of our lives during the months to come. Today, I want to dig in a little deeper and talk about what the 3 W's should look like in practice. First, wear a face covering in public. This means wearing a cloth mask over your mouth and your nose whenever you're in public, meaning whenever you're around people who are not in your immediate household. Public doesn't just mean places like the grocery store or the post office. Public also means gatherings with extended family or close friends, or when you're going to work. Remember, you can have COVID-19 and not know it. Second, our wait 6 feet apart. This means keeping space between yourself and other people wherever you're outside your home. And keeping distance doesn't mean just spacing yourself out while you're waiting online at the store or letting someone else go and waiting for the next elevator. It also means just generally avoiding crowds. Gatherings of people are more likely to become super spreader events, as we've unfortunately seen this in our college campuses. Current executive orders and our phase 2 status means that North Carolina continues to have strict limits on group gatherings in effect. No more than 10 people indoors and no more than 25 people outdoors. The third W, wash, means washing your hands or using hand sanitizer to keep your hands clean. In particular, when you're out in public, you should be cleaning your hands often. For example, before and after leaving a store, or after touching a public surface like a gas pump. Bring your hand sanitizer with you in your car, in your purse, in your pocket, and use it often. Public awareness about the 3 W's and how to practice them has been critical to slowing the spread of the virus in North Carolina. And that's why this week we launched Las Tres M's, a public awareness campaign in Spanish. The campaign brings this important information directly to our Latinx Hispanic communities, which we know have been disproportionately impacted by COVID-19. We know that Latinx Hispanic cases represent 38% of our state's cases, but they only make up 9% of the total state's population. Many in our Latinx Hispanic community work in essential industries that North Carolina relies on, such as construction and childcare, food processing, and are therefore at higher risk. Serving this community is a top priority throughout our response work, including through this new public awareness campaign. While prevention is our best defense, we also continue to bolster our testing and support services. We have a new toolkit to help community organizations like places of worship and nonprofits and others who want to host community testing events. You can get that toolkit right now on our website. And today, the governor announced a significant investment, $175 million, to help people avoid eviction and pay their utility bills as they grapple with the impacts of COVID-19. Having a stable, safe place to live is fundamental to well-being and health. Stay tuned for more on how folks can sign up for help through these two new programs as they get up and running in the next couple of weeks. We also continue to prioritize supporting people and families in our COVID response. And I'm very proud to share that this week we'll be launching another important initiative, the new COVID-19 Support Services Program. It's going to assist North Carolinians in up to 20 targeted counties who are asked to isolate or quarantine, but also need help accessing food or relief payments or access to primary medical care. Treating any disease is so much more than just giving out a diagnosis. We have to treat the whole person. People in these targeted counties who are struggling to safely quarantine will be connected to a community health worker who will coordinate needed services, which may include nutrition assistance, a one-time COVID-19 relief payment, transportation to and from essential locations, medication delivery, or other services. The COVID-19 Support Services Program builds on the Department of Health and Human Services' nationally recognized work to address the non-medical drivers of health and taps into our state's infrastructure to buy health and not just health care. Community health workers will use NC Care 360, the nation's first statewide technology platform that connects health and human service organizations. They'll use NC Care 360 to make connections to services and to track referrals. This is groundbreaking work, and I'm really proud of North Carolina's innovative and comprehensive COVID response approach that continues to keep focus on our community's health and their well-being. So, as I conclude today, I'm urging everyone in North Carolina, including those in higher education community, to be practicing those 3 W's. Wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. It's the 3 W's: wear, wait, and wash. So with that, it's just me today, so I'm going to turn it over and open it for questions. Thank you.
Our first question is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Thanks for the time and accessibility. Again, we appreciate it. Brian Anderson here with the AP. Had 2 quick questions for you. First, with regard to the COVID-19 dashboard on the Department of Health and Human Services website, it would be helpful if we could see, just like you do for cases going back since the start of the pandemic, if we could see the same thing for testing. Going on it, we only see it over a month. So my question is, it seems that we have a low in tests completed over the last 2 days, certainly a month-long low. I'm not sure how long that is historically. Why is that, and how long has it been since we've seen tests conducted this low? And then I'll ask my follow-up right after that for you.
Thanks, Brian. Yes, we have seen lower amounts of tests done just in the last couple of days, but even last week was a lower testing week for us overall. we've been analyzing this closely to try to understand, is there a particular part of the state that has lower testing? Is there something else that we can glean? And what we're seeing is really slowing of testing across the board. Doesn't seem to be in any one part of the state. And what we're seeing is that slowing, not just here in North Carolina, but in states around us as well and around the country. I know I have talked to some of my colleagues around the country to understand this and what they are seeing, and we're sort of all seeing a slowing. We think it's a number of factors. We think less folks are just showing up to get tested. We're not sure if they still think that testing results are taking a long time to come back, which they're not. We want to make sure folks know testing turnaround times and results are coming back faster. We're now seeing results in 2-3 days, sometimes even faster. So test results are coming back faster. We thought maybe, is it the summer? People are on vacation. But again, here in North Carolina, we're getting back to school here. So we're hoping to see our numbers pick up. We announced late last week about a new testing vendor that the state has partnered with to, again, offer even more free testing for folks. We do not want cost to be a barrier. We have more than 500 testing sites, and more than 600 actually now on our website. So we have the locations. We're trying to make sure cost is not a factor. We want folks to know that testing is needed, that you can get your results turned around fast. And so we're going to continue to talk more about this, because we do think testing is really important, but we want folks to make sure that they're showing up to get tested. I'd want to remind folks about who should get tested. Certainly folks who have symptoms, right? Cough or fever, anyone who's been exposed. But we also want folks in higher risk jobs or higher risk settings to get tested as well. And that includes, now that we're seeing some viral spread in our university campuses, if folks are in those locations, to also think about that as an exposure and to go get testing. We've said before, if you are in a crowd, as I talked about, we don't want you to be, but if you find yourself in a crowd, that might be a reason to go get tested to make sure that you have not contracted the virus. So we're noticing that lower testing. We definitely want to see that improve. We're trying a number of ways in which to increase our testing, working with stakeholders, getting more free testing out there, but we'll continue to do that as we go. Thanks, Brian. And I know you had a second question.
Yes, I wanted to ask with regard to UNC-Chapel Hill reporting a positivity rate in its COVID test the second week of classes of 32.2% compared to 2.8% before classes had started. Some students I spoke with said that this comes as no surprise that these campuses have shut down, and we know 4 out of 16 public colleges and universities in North Carolina have shut down, including the 4 largest in terms of undergrad enrollment. Were you surprised to see them shut down so quickly?
Well, thanks for that, Brian. I think nearly 2 weeks ago now, when the governor and I were here talking about the next phase of what we would do with easing restrictions, we said we need to pause. And we said that because as we knew there would be opening of higher ed institutions, universities, and colleges, as well as our K-12 schools, we knew more people would be moving around. That means more virus moving around. So we knew that this was going to be something we needed to watch very closely. And so that is exactly why we paused additional easing of restrictions back 2 weeks ago. We knew that there would be some viral spread from the reopening. And I think what we have been trying to do is make sure that we are understanding what are the drivers of that spread. And what we are seeing is that spread of virus is in social gatherings, parties, particularly ones that are off campus, as well as housing that is off campus as well, sororities, fraternities, other group houses. And we are also seeing some viral spread in some of our athletic teams. So what that shows us is that, look, off campus in particular is still subject to our executive orders, those that should be limiting gatherings and are requiring face coverings. It's why I spent some time today on the 3 Ws. Those are the things that really need to be part of the actions that everyone is taking: avoiding crowds, avoiding parties, whether you're at a university setting or not, and wearing a face covering all the time. Thanks.
Our next question is from Dewan Hogard with ABC 11.
Hi, Dr. Cohen. Dewan Hogard, WTVD. Just wanted to again follow up on that last question. What do you say to the Board of Governors who decided to send all these kids back to school, understanding what was going to happen? And then secondly, this 5 weeks that we're in, when you're looking ahead to possibly moving on to phase 3, these gyms are really struggling. Do you see the state reopening for gyms come September 11th?
Thanks, Dewan. Well, first to the folks at UNC, I know everyone is working hard to get their arms around the viral spread at Chapel Hill. We at the state have been working with folks at Chapel Hill, at NC State, at ECU, and others, and will continue to be a resource. Now, the university, I know there is more the university can do, and we continue to work with them, particularly as they think about what is happening off campus. And there are tools the university can use related to student codes of conduct and holding students accountable for their actions both on and off campus. And so I know this university is moving in that direction, and we want to encourage them to continue that. This is about making sure that the guidance that we have on paper turns into the implementation that we need to see, and we need to see the universities do that and make sure they're using all of the tools at their disposal to make sure that students, again, whether on or off campus, are abiding by that guidance and the protocols to keep them and their communities safe. Thanks. Oh, gyms. Dewan, let me get your second on gyms. So again, as we're going to have to continue to watch our trends during this time. And I'd say we're seeing some additional viral spread. So from 2 weeks ago to last week, we did see a slight increase in our cases, very slight. To last week, and that is largely driven by some of the reopenings in our universities and the viral spread we're seeing at some of those campuses. So we're going to have to see where our trends are. The thing is, we know what works, and it's the 3 W's. So if we continue to do the 3 W's together, and we all work at this together, whether it's in our universities and college settings or throughout the state, I think we will continue to see progress in our trends. Assuming we do, then we do want to make progress in additional reopenings of things like gyms and others. But we need to see continued progress with our trends going in the right direction. And as of last week, they started to tip in the wrong direction. Thanks.
Our next question is from Vanessa Ruffus with WCNC.
Hi there. Thanks for taking my question. This is Vanessa Rufus with WCNC Charlotte. I did want to speak a bit more on the trends that we're seeing with the metrics. I know you had just briefly touched on that just a moment ago, the increase in the new daily cases, and I'm starting to see as well with that average line, the uptick in the positive test rate just a little bit. Is this something that could be reversed? Or is this something that we've kicked off this trend heading upward, and this is just kind of the ride that we've started on at this point?
Thanks, Vanessa. While we have been making progress, we knew that progress was fragile. And we're seeing some of the additional viral spread in our 18 to 24-year-olds drive some additional cases. It is slight. I would say that the cases going up at the end of last week and some of our percent positive going up, very small. So I think there is plenty of opportunity here for us to make sure that we're getting back to stable and back to declining cases, which is what we want to see. And it goes back to those simple 3 W's. I know it's repetitive. I know everyone is weary of this virus and the 3 W's, but these simple actions is what is going to help us make progress. When we don't have a medicine and we don't have a vaccine, it's the 3 W's that is our way of defeating this virus. And again, just to reiterate about this, and I want to be specific, I think we see a lot of good compliance with face coverings, for example, in grocery stores and settings like the post office. What we're not seeing is folks wearing face coverings maybe when they're with their extended family or their friends. That is a place where you also want to be wearing a face covering. And again, you want to be avoiding large crowds in any sort, whether it's associated with a university at off-campus party party or somewhere else. I think large gatherings show us that this virus can spread quickly. So if we can keep doing the 3 Ws, I do think that we can continue to see positive progress in our trends, and that's what we're going to work hard to do.
Our next question is from Lynn Bonner with the News and Observer.
Hi, this is Lynn Bonner from the News and Observer. Thanks for taking my question. With the Board of Governors making the decision last spring about returning to campuses, was that too soon to make a good assessment on whether students should have come back in person? And secondly, now that so many clusters are popping up on university campuses and some within athletic departments, are you or the governor advising college presidents to cancel the fall sports season?
Well, thanks, Lynn. I think with this virus, we are always learning new things, and we need to make sure we're incorporating our new learning into both the guidance that we give as well as the actions that we take. I think that's exactly why we updated our guidance last week to really focus on those off-campus activities that we see are driving some of the viral spread, and to really point out to universities that they need to be doing more here, using their student codes of conduct, using honor code violations to really make sure that we all take accountability for what is happening, and we need those universities to be doing that. So I do think that we always need to incorporate the new learning that we do and have that come out in the implementation that the universities are doing. And as far as athletics, I think that there are different kinds of athletics here. So one are some of like the rec, youth activities, and we have guidance there that we still believe that contact sports are not something that either our youth, high school, rec folks should be doing. So things like contact sports like basketball, soccer, football are again things where people are going to be in close contact together for longer periods of time. And that's not things that we think should happen. Now, when you talk about professional college sports, they are doing and taking very different kinds of protocol, whether it's testing or you see some of our professional athletes going into bubbles, right? They're taking different kinds of precautions that generally we don't see in the rest of the public. So they are exempt from our executive orders in terms of moving forward, but it is exactly why our gyms continue to be closed here in North Carolina. We continue not to recommend contact sports because, again, those are the activities that are more risky for viral spread. Thanks.
We have a follow-up, Lynn Bonner, News and Observer.
Thank you, Dr. Cohen. Could you address Division I sports like football and basketball? I don't believe that these athletes are in bubbles like professional athletes. So what would you advise those programs to do, considering that we're seeing clusters pop up in athletic departments?
Thanks, Lynn, for that question. And I think a number of them are governed by different rules and player protocols within the, depending on the sport that they play. But I know a lot of our Division I sports are doing a testing regimen that is very aggressive, and they're doing other protocols of trying to cohort folks together. I know it may not be a perfect bubble, but bubble-like activities. And those are the kinds of things. Avoiding large it's the same thing. Avoid large gathering. Wear your face covering. And then I think they're adding other layers of things like repetitive testing and such. It can't be one-time testing. Has to be repetitive testing if you actually want to understand if there's viral spread within your athletic team. So those are the kinds of things. But I will say that each sport and each collegiate governing body has different protocols that they are going through.
Our final question today will be from Rebecca Martinez, WUNC.
Hi, Secretary. It's Rebecca from WUNC. I have another question about gyms. A survey recently came out indicating that 16% of people who have memberships to gyms have started going back, even though gyms are still ordered closed under phase 2. I'm wondering, is this something your office is aware of? Are there any plans for enforcement?
Rebecca, thanks for that question. I'm not aware of that number or where that data came from, but you are right in saying that our executive order it says that gyms should be closed at this point. Again, let me just step back to help folks understand why. That even if your gym is open, which it should not be, that the reason that we are concerned about gyms is because it is a place where when you are exercising, you are breathing heavier. And when you breathe heavier, more viral respiratory droplets have the opportunity to leave your body and go to others. And so we know it is a place for more viral transmission. And again, we're just trying to cut down on the number of activities that folks do that are high risk. So we very much think that folks should understand the risks at gyms. Gyms are not supposed to be open. And I know that there have been enforcement. Those are our local law enforcement has been working hard to enforce, and I know have closed a number of gyms that have been open, and then they go and make sure that they are closed and even take some additional enforcement action if needed. So we'll continue to monitor those and make sure that we're taking the action needed. All right, I think that was the end of our questions here. Appreciate that. Again, spent a lot of time on the 3 W's today. It's really important. That is what is going to help us continue to make progress here in North Carolina. So wearing a face covering over your nose and mouth, waiting 6 feet apart, avoiding large crowds, and washing your hands. Carry that hand sanitizer with you wherever you go. Thanks for all that you are doing, North Carolina, to help us through these hard times. All right, thanks so much.